So checkpoint inhibitors in gastroesophageal cancer is a difficult discussion. And so we talked about this yesterday too during the discussion of the Javelin study, which was the most recent phase 3 study to come out. And at the moment, today, the current approvals in the US are for pembrolizumab in the third line setting for PD-L1 CPS 1 or higher, or with MSI high tumors in second line setting. That's the current approval. We've had studies, phase 3 studies in the second line setting and in the first line setting, namely Keynote 61 and Keynote 181 in the second line setting and Keynote 62 in the first line setting. And they've had mixed results essentially, something that I've been calling a yin-yang survival curve, where the curves cross. And initially, the patients that are getting the immunotherapy are doing worse than the control arms, and later, patients are doing better than the control arms, the yang part of the curve. And so what that really means is that there's a subpopulation that's doing poorly with immunotherapy compared to control, and a subpopulation that's doing very well, better than the control. And so it's our job to parse out who should be and should not be getting these immunomonotherapies. And so that's where it stands. Those studies have not led to approvals because their intention to treat of the study, the primary endpoints were negative, but these persistent signals come out with subgroups that we see: patients with low burden of disease, patients with good performance status, patients that have higher PD-L1 scores by combined positivity score are the ones that MSI high for sure tumors that persistently show benefit, and then certainly patients who are high volume disease, rapid progressors, poor performance status, unfortunately many of our patients, and PD-L1 negative patients by CPS score, which is about 40 to 45% of our patients. That is a negative predictive value. They're not going to benefit from checkpoint monotherapy, and they're better served with standard of care. So right now, the studies that need to be done and that we're waiting for are looking to prove in that subgroup that seems to benefit, so that we can get regulatory approval to move these drugs to earlier lines of therapy.